Hey gang, posted a before and after of ultrasound-assisted Tumescent liposuction, before and after of a very large lipoma on a woman's back. And of course, getting a lot of lipoma questions. So first, what is a lipoma? A lipoma is technically a tumor of fat cells. Now, it's a benign tumor. It is very, very, very rare that it can be malignant. And they're very common. A good double-digit percentage of people could have one. They could be the size of a quarter. They could be the size of a human fist or bigger. Obviously, they become a problem cosmetically or on certain areas of motion or on the back and you're leaning, or they stick out of a shirt, and it could be problematic. So most people do want to get rid of them. Now, the standard of care has always really been just cut it out, remove the fat cells, remove the core. It's not encapsulated like a cyst, but there's this like fibrous core that you have to really get out so they don't come back. But the problem is the incision, because usually, if they're small, they're pretty easy, but as they get larger, the incision could often be the size of the fatty tumor itself, and it could have legs. So, if it's an area like the back or an area under motion, you could have a very long scar, and it stretches over time, which is not very appealing cosmetically. So a lot of people don't know that you could liposuction these out. It's not like removing regular fat. It's a little bit more difficult, which is why I always use ultrasound-assisted Tumescent liposuction. It is still performed under local anesthesia. You don't even need a Valium for it. Most people, you could take a little something like a glass of wine's worth, but once you're numb, like going to the dentist, you don't feel a thing. I go in through 1 or 2 teeny holes that close up without a stitch within 24 to 48 hours, and I use an ultrasound device called the Vaser to kill all the fat cells, melt down the fibrous tissue so that I could extract it all out. It's important to get that fibrous core so it doesn't come back. I actually have never had a recurrence in 20 years. And fortunately, the patients who have come to me had already sought out consult and really didn't want that huge scar. So, again, lipomas, very common, rarely malignant or detrimental, but they can grow, they can recur, and if you want a really safe, a really fast, that's the other thing. Recovery is so much less when you're doing it with Tumescent liposuction. There are no stitches. You could exercise in like 3 or 4 days easily after lipoma, as opposed to weeks when you have a big scar with stitches. So, safe, easy. It isn't covered by insurance, but it's a very quick and effective way to cosmetically remove a very bothersome condition. Lipomas, ultrasound assisted Tumescent liposuction. Come check it out.